Labyrinthitis is an inflammation of the labyrinthine canals of the inner ear, which is the most common cause of vertigo. A common cause would be a viral respiratory tract infection that spreads into the inner ear. Other causes can be drugs, foods that we eat, and of course, alcohol. And a rare form of labyrinthitis is caused by bacteria, which is usually associated in the middle ear and mastoid infections. So now moving on to clinical manifestations. Clinical manifestations include nausea, vomiting, nystagmus, which is a condition in which the eyes make repetitive, uncontrolled movements. It could go either vertical or horizontal. Photophobia, headache, and ataxic gait. Assessment. So for assessment, subjective data includes frequency and duration of the vertigo, which vertigo is the common symptom of labyrinthitis. So we should assess other symptoms such as hearing ability, tinnitus, nausea, and fear. Fear because it's associated with the attacks, so we must explore the patient's feelings. And objective data includes noting the vomiting and any signs of nystagmus and laterality, or even assess coloration and moistness of the skin to determine the extent of the autonomic response. As far as diagnostic testing, normally they do a electronystagmography done to record involuntary movements of the eye, and it may show diminished or absent nystagmus with stimulation. They also do audiometric testing, which shows low-tone sensorineural hearing loss. Medical management. So labyrinthitis has no specific treatment. Usually antibiotics and dimenhydrinate or meclizine for vertigo are prescribed. If nausea and vomiting persist, administer parenteral fluids. Nursing interventions and patient teaching. So it is important to know the frequency and degree of vertigo. So we administer antibiotics and medications and assess fluid intake for dehydration. Meniere's disease is a chronic disease of the inner ear characterized by recurrent episodes of vertigo, progressive unilateral nerve deafness, and tinnitus. There is an increase in endolymph fluid, either increased production or decreased absorption. This causes increased pressure in the inner ear labyrinth. Attacks of severe vertigo, tinnitus, and progressive deafness result from this increased pressure. Usually, one ear is only involved. So clinical manifestations. So the patient can experience recurrent episodes of vertigo, which is associated with nausea, vomiting, diaphoresis, and nystagmus. As you can see, here is a little illustration of what most symptoms are. So as far as assessment, there is a collection of subjective data, which includes noting the frequency and severity of the vertigo attack, tinnitus, and assess actions taken by the patient during the attack, and the degree of relief by those actions provide. Collection of objective data, which is determining unilateral or bilateral hearing loss. So, to confirm diagnosis, 2 or more episodes must be documented. Diagnostic tests such as MRI or CT are often ordered to rule out a central nervous system disease. Also, an audiogram demonstrates mild low-frequency sensorineural hearing loss. Tuning fork tests show a sensorineural deficit, and vestibular testing shows lack of balance. So, MRI, CT scan. There is no specific therapy for Meniere's disease. However, fluid restriction, diuretics, and a low-salt diet is prescribed to decrease fluid pressure. Advise the patient to avoid caffeine and to avoid nicotine. So, nursing interventions and patient teaching: maintain a prescribed low-salt diet, administer diuretics as ordered, bed rest, sedation, antiemetics, and during an acute attack, keep the patient in a quiet, dark room in comfortable position, and the patient may have some auditory deficit which requires alternative methods of communication, and the patient's tinnitus becomes distressing and increase in background noise such as music may provide relief. Have an emesis basin available because vomiting is common. So, the patient should learn to identify precipitating factors and all the proper actions to take when an attack occurs. 1. Sit and lie down immediately. If driving, stop the car and pull over to the side of the road. 3. Keep medication available at all times. And that is it. Classmates, thank you for watching.